Less time versus time control of hypertension in pregnancy. Background. The effects of less time versus time control of hypertension on pregnancy complications are unclear. Almost 10% of pregnant women have hypertension. Hypertension is present in 1% gestationally hypertension without proteinuria developed in 5 to 6% and preeclampsia developed in 2%. 1. Pre-existing hypertension and gestational hypertension before 34 weeks and associated with an increased risk of perinatal and maternal complications. Blood pressure target for women with no severe hypertension during pregnancy are much debated. Relevant randomized controlled trials have been small and of moderate or poor quality. Type control, the use of antihypertensive therapy to normalize blood pressure, has been associated with maternal benefits but sometimes does not coincide with perinatal risk. International guidelines for non-severe hypertension during pregnancy recommend treatment goals consistent with age, less time control, or time control. The control of hypertension in pregnancy study was designed to compare less time control with time control of no proteinuria. No severe hypertension in pregnancy with respect to perinatal and maternal outcomes. Well, the conclusion about this topic, we found to significate between group difference in the risk of pregnancy loss, high-level neonatal care, or overall maternal complication. Often less time control was associated with a significantly higher frequency of several maternal hypertension.
Hypertension is another common problem that makes pregnancy high risk. And there's really two good categories in my mind. There's sort of what we call pre-existing hypertensive. That's somebody that was already hypertensive, had high blood pressure before they became pregnant. And then there's pregnancy-induced hypertension is one term for it. Preeclampsia is another term. And that's an issue with your blood pressure that happens later on after you become pregnant. And that's really a kind of a separate issue on its own. I'm going to spend a video just talking about that. So let's talk about essential hypertension or pre-existing hypertension. This is somebody that has high blood pressure the first day they come in for their first visit, or somebody that's already been being treated for hypertension or knew they had hypertension before they got pregnant. And this does increase the risk of pregnancy for several reasons. If your blood pressure gets really, really high, it can cause a major problem and you could even lose your pregnancy. But even having high blood pressure that's just mildly elevated throughout your pregnancy can affect changes to the placenta